Thank you very much for this question. I really like it, but I'm not very sure that I can answer it confidently or even clearly, but I want to try. And the reason I say that is because sometimes it can be really difficult to distinguish normal life challenges from symptoms of a mental illness, even for the best trained psychiatrist or the most experienced psychiatrist. And we need to talk about this more, the gray area, because the way that we speak about mental illness is like it's separate from normal mental health, yet it's on a continuum: mental health, mental illness. And we want to be able to identify that line that allows us to discern, am I going through a negative life experience or am I suffering from a mental illness? Because each requires different solutions or interventions. I'll give you an example before we get into this. Sadness is a normal life experience, a negative life experience, but normal life experience. But sadness is also a symptom of depression, which is a mental illness. So as a clinician, you want to ask yourself, how do I draw the line between normal life sadness that an individual needs to experience, as uncomfortable as it is, to be able to build patience, strength, and cultivate resilience, from sadness as a symptom of mental illness that I need to address clinically. And I often say this, that you want your clinician to take time to understand your symptoms. Because if a clinician doesn't take the time to thoroughly assess what you're presenting with, and they misdiagnose you with a mental illness when really what you have is a life challenge, then they deny you the opportunity to build resilience in yourself, to be able to face future obstacles, right? So then that is likely to put you at risk of becoming dependent on professional support. But also, if the clinician does not identify the mental illness that is preventing you from dealing with the obstacle, then they're promoting you staying stuck or being stagnated in that problem, which is also not good. And so assessment then in psychiatric disorders or mental illnesses requires time and thoroughness. And so coming to this, delusion or denial, which one is it? Is one of those scenarios that can be very difficult to distinguish. If we're to categorize them, theoretically, it's very straightforward, right? A delusion is a symptom of a mental illness. It's a symptom of psychosis, and we have psychotic illnesses. The most common one is drug-induced psychosis or substance-induced psychosis, and the less common one is schizophrenia. And there are many others. And denial is a normal life experience. It's an ego defense. What this means is that when you're facing something devastating or overwhelming, your mind offers you a defense to protect itself against going crazy or losing itself, like losing your mind. That's the function of a defense mechanism. And that's what denial does. And each one of us has experienced it. Often it occurs unconsciously, but it can also occur consciously. But a delusion always occurs consciously. Now, categorizing it theoretically is very clear. And this informs clinical practice. So when you come down to clinical practice, now you want to look at the definition. And this is where it gets complicated because they share the same definition. In essence, denial and delusion is rejecting reality as it is, in simple terms. And so, for example, in the video I made, the wife believes that the husband cannot cheat, even when she's presented with convincing evidence that the husband is cheating, obvious evidence. Everyone else sees it, even the husband knows it. He's not even hiding it. But the wife still says the husband is not cheating. That is rejecting reality. And in that situation, you can say the wife is in denial. You can also say the wife is delusional. But as you talk to the wife to understand how she perceives the reality she's living in, then you'd be able to discern denial from delusion. Because delusion, this is a false, fixed belief despite contrary evidence, and is not amenable to change. The person is not going to change what they believe in. That's a delusion, very firm. But denial, the person is refusing to acknowledge the reality in front of them because it's overwhelming for them to bear. It's devastating for them to acknowledge. And so you can see the distress in the individual when you try to help them see the reality as it is in front of them. Whereas with delusion, they don't get overwhelmed. They get agitated that, you're trying to tell them that they're crazy in a way, but they don't get distressed usually, but they can also get distressed. And then the other thing is that when there's intense denial, it can lead to delusion. And we see this in unfortunate incidences where a woman has gone through a miscarriage after carrying a baby maybe for a couple of months. So let's say this woman is 5 months pregnant. They're so excited about all the things that they're going to do for their baby, and then they go to the doctor for their normal routine tests, and then the doctor says there's no heartbeat. That's a lot to take in for this person, and the mind is unable to process that news. So then denial as an ego defense comes in to protect this individual from completely going crazy or nuts. So it's a very self-protective mechanism, and in the short term it's very useful. So the woman is going to deny that the baby is dead, but we'll go through the process of having the fetus that has died evacuated from her uterus. But she's not present to that reality because for her, she's still pregnant. Now that's denial. The way that it can progress into delusion is that this woman might persist with that denial and start acting on it. So now she believes that she's still carrying a baby, and coming to the realization that she isn't is very stressful. So she might start then projecting the distress that is internal. And she might start saying that somebody has stolen her baby. She has her baby, but somebody took it out of her and has stolen it from her. And then she starts believing in that narrative that somebody has stolen my baby. So when she sees somebody who's pregnant, she believes that that pregnancy is their own baby, that it was stolen. And then this is now delusion, right? That the woman believes so strongly and firmly, which is false, that somebody else is carrying her own baby. And when they give birth, they have to give that baby to them. Or they might even steal a child and believe that they gave birth to a child. So you can see denial from devastating news, which is supposed to be an ego defense, when not dealt with properly, can transition into a delusion, which then becomes a symptom of a mental illness that needs to be treated by a professional. I'm hoping this has helped a bit, but like I said, it's not very straightforward, it's not very clear. You really want to take time with the individual to understand how they're processing these things, how they're processing their reality, to be able to distinguish or discern, is this a delusion or is this denial? I know it took a bit long, but I hope that was helpful.